I walked in on a patient and she had been lying on the couch for 14 hours. Her husband had recently passed. And she just wanted to hold the flag, and she ended up losing her balance. She put her walker to the side to reach for the flag. And she said, it took everything in me, but I threw myself on that couch. And she said, I was scheduled to come at 1 o'clock. So she just watched the clock all night long and knew I was coming at 1 o'clock.
For 14 hours.
For 14 hours, nobody checked on her. The phone rang and she thought, oh good, somebody's calling me, they'll come and check on me. Nobody came. And when I walked in the house and I heard, oh Carol, thank God you're here. Her voice was so weak. I ran over, I took a look and just saw the way she was like, but she was an OR nurse and she knew how to take care of herself all night.
That's right. Those nurses are tough, aren't they?
Yeah, she managed to get through the night. But the first thing you do, she's diabetic. Check her sugar, check her blood pressure, check her heart rate. Let's call the doctor, get her something to eat and drink.
An individual clinician can do only so much, but the help of the nurse and the therapist and the nurse and the social worker, you spoke to that a little bit. Talk to me a little bit about how important you think that is in the work that you do. Just
the communication that you can have between, when you see a change in a patient. Hey, I really think Ruth is struggling more with her balance. I knew that Wendy was going in the next day and work with Ruth on her balance. Maybe having Ruth do something that she didn't even know she was working on her balance, just passing a ball back and forth to each other while you're standing. Balance is working with the proprioception, and Ruth didn't even know she was doing it.
That's good therapy. You gotta sort of sneak it in.
Yeah. And just having that communication back and forth, like, hey, I really think that I heard more crackling in her chest, even without a stethoscope. That means that I should get back in there and listen to her lungs and reassess. Let's prevent that hospitalization.
You work in the ICU. It's a very controlled environment, right? And you've got pull
you've got
cars
machines
and push cars, and you've got a team that sort of covers your back, and you don't have to think about the dog. And you don't have to think about any of that other stuff, but you speak you get it. Right?
Yeah.
So, but you don't learn, I don't know that you learn that in the hospital. So where did you pick up this, because you're looking at all of the other social needs that these folks have, because that's really what we're trying to do.
And I think that develops along the way when you're working with your coworkers, and you see, when I oriented with the Burke office, they let me go out with the medical social worker, and I got to have a hands-on look at what exactly they do. And occupational therapy, they just do so much more than I ever thought, as far as thinking about every little step to get in and out of the shower, and how are you going to bathe safely. Yeah, they could probably do it, but they might end up falling. Or cooking in the kitchen, are they even coherent enough in their mind to turn on the heat and remember to turn off the heat?
What I loved about doing home health care for the 5 years that I did it was, you have to be the best PT or the best nurse to deliver home-based services, because you're not just a PT, you're not just a nurse, you're a little bit of a social worker. When care is delivered effectively, it's holistic, right? And it isn't just the client, it isn't just the family member, it's the dog, it's the,
right.
And so you can do a lot by sitting, listening, and watching, right?
Every day is a new adventure for skilled nurses. You're just getting up and knowing that you're going to make a difference. So we like to meet people where they are and really bring them what they need.